Also, another round of mass testing in Beijing's most populous district after authorities announce a ferocious COVID-19 outbreak linked to a bar cluster. And for more, let's bring in Professor Alan Wu, Director with the Center for Public Health Research, Nanjing University. Professor Wu, China's leader has called on his government to adhere to its zero-COVID policy while striking a balance between the economy and social stability. Do you see this happening with this latest round of mass testing as well as lockdowns?
Well, the mass testing is still implemented, but the lockdowns are quite rare, particularly entire-city lockdowns. You basically, recently you have seen Shanghai and Beijing, but in other parts of the country, you don't really see large-scale lockdowns. So I think at least this is a quite big step in terms of disease control and containment. So what we see around the country is that once you have identified a few cases, that they will conduct quite a large-scale testing, trying to find out who is infected, who is actually infected without any symptoms. So far, this approach has been working pretty well in China, but you do see a very, severe side effect on the economy and people's mobility and the business as well. So this is something actually I believe the authority has been thinking and trying to do some kind of a modification. And you do see certain modifications around different parts of the country in terms of dealing with the control.
But what hasn't really been working so well is getting people vaccinated, especially among the elderly. I mean, we know that more than a third of the elderly have not been jabbed. And while the government has been resolute on its virus strategy, why haven't they taken a tougher stance on this?
I think, there are at least two reasons. One is that the misconception of the vaccines. Many of the elderly do not trust the vaccine. They think there might be some kind of side effect and severe adverse effect, which may cause some problems. That's one thing. The other thing is that many of the elderly have certain basic medical conditions which do not allow them to take vaccines. And initially, China promoted its vaccines to the younger groups, particularly people who are younger than 60 years old. So that's why it's quite slow in promoting the vaccine in the elderly groups. Now we realize that these groups are highly vulnerable to the virus, and also the vaccines are safe in this group. So that's why we push very hard in increasing vaccination rates in the elderly population.
Right. You've mentioned, this lack of trust between the public and the medical establishment, especially among the elderly. Then why not put in more effort to, boost their trust in these vaccines?
Well, they do put quite a bit of effort in trying to promoting and doing, public campaigns to make people to take more vaccination. But I think in a way that China not heavily relies on the cell phones and all those, the modern technology to promoting the vaccines. The elderly population hardly use those devices. And I think, there is a penetration problem here. So China is a big country. To reach such a large population is not going to be easy. And I think initially the vaccination campaign message also it's poorly designed as well. It's not effectively reach those people and accepted by elderly people.
I'm also wondering, Professor, how much has the issue of vaccine efficacy and Beijing's rejection of foreign mRNA shots impacted its reopening plans?
There are two things. I don't think, my personal feeling is that I don't think government rejects the mRNA vaccines. So basically, they have a number of companies developing their own mRNA vaccines, which recently one actually went into clinical trial. I think it's a more kind of, commercial interest in certain ways, government trying to protect its own industry. The other thing is that the early vaccines China put into the market, the inactive vaccines, subunit vaccines, at least those vaccines are working well, not in the sense that they provide the so-called acquiring of the infections, but they do provide sufficient protection against severe diseases and death. So that's why the government actually put a tremendous effort in promoting those inactive virus vaccines. Right now, they realize that the Omicron is spreading so fast that the mRNA vaccine is now getting into clinical trial. I hope that in the short, in a not very long period, that this vaccine would come out.
Well, it's spreading fast, but the numbers are still considered small globally. So what do you think, at what point, what is it going to take before the government says, okay, the virus has become endemic, we're going to be like the rest of the world?
Well, that's a very good question. We have been discussing this. You see, when in Delta variants, the zero tolerance policy has been working very well. It actually put the virus under a strict control, and you avoid a large scale outbreak and a large number of deaths. But in the Omicron, the situation is quite different. The virus is so transmissible, so infectious that before you identify the virus has been circulating without any noticeable signs in the population. The example is Shanghai. Once you identify a few infected cases, actually the virus has been spreading in the entire population. So that's why the Shanghai suffers so heavily in terms of it's a lockdown and it's a screening effort in all sorts of public health approach. So the issue here is that whether this zero tolerance policy is sustainable. I personally do not believe this is sustainable. Maybe you could control the virus in the city, but after a short while, the virus will come back, or maybe it bounce back in other cities as well. So that's basically what we have seen from the early years, that the virus, the new infections never stop. It basically, spreading all over the country, although in a small scale, but it causes tremendous problem.